Welcome to Motivation at Hand. To know is to know how. Make your foot the foot that counts. In a world where patriarchy's grip is strong, women's issues are poignantly done wrong. In cells confined, women's lives unfold. Their stories of struggle, often untold. Increasing numbers, a concerning trend. Incarceration's impact, we must comprehend. Reality shows a different plan. Statistics reveal disparities and strife. Gender inequalities a part of life. Female inmates respond better to gender-responsive programs designed specifically for women. The rising female incarceration rate has contributed to an increase in the intergenerational cycle of crime. Female inmates have higher rates of addiction, mental illness, and trauma than male inmates. The incarceration of women in the United States has been on the rise, leading to significant consequences for families and children. Adding to the increase documented by the policy and politics of reproductive health. Incarceration of women have increased by 475%. This report explores these studies surrounding the very high increase in the incarceration of women and the impact on their children and society. 1. Psychology Today article. Female inmates, overlooked and often forgotten. By Michael Pitero Ph.D., the Crime and Justice Doctor. 2. Arrests of Enforced Interventions on Pregnant Women in the United States, 1973 to 2005, Implications for Women's Legal Status and Public Health. Lynn M. Paltrow and Jean Flavin. N3. National Advocates for Pregnant Women changes name to Pregnancy Justice. An overview into the surge in female incarceration. According to the Sentencing Project, 2022, the number of incarcerated women was nearly 5 times higher in 2020 than in 1980, marking a staggering increase of more than 475%. The COVID-19 pandemic initially led to a decline in incarceration rates as authorities sought to reduce virus transmission. But many states reversed these practices in 2021. This surge in female incarceration has raised concerns. Disproportionate impact on African American women. African American women have been disproportionately affected by this increase, with imprisonment rates nearly twice that of Caucasian women in 2020. At the same time, sentencing guidelines and mandatory minimum sentences have played a role in driving up female incarceration rates, contributing to racial disparities. General characteristics of female offenders. Female offenders share many characteristics with their male counterparts, including age, socioeconomic status, and race/ethnic background. African American and Latino women, particularly those from low-income backgrounds, are overrepresented in the prison system. Approximately 58% of incarcerated women are mothers of children under 18, with most having been the primary caregivers before their incarceration. Impact on children and families. The arrest and incarceration of mothers often result in child welfare services involvement, even when the underlying convictions are unrelated to child abuse or neglect. Many imprisoned females have their parental rights terminated, leading to generational cyclical effects of incarceration and foster care placement. Addressing trauma and mental health. Female offenders often have higher than average rates of trauma, physical and sexual victimization, untreated mental illness, and substance abuse. The need for trauma-sensitive resources and services is critical, yet few correctional institutions have gender-responsive programs or specially trained staff to address these unique needs. The incarcerated mother. Maintaining mother-child relationships during incarceration is a significant challenge. When mothers are incarcerated, children are more likely to be cared for by family members or placed in the foster care system. Research indicates that a mother's incarceration can lead to multi-generational effects, attachment issues, diminished school performance, delinquent behaviors, and mental health issues for children. Pregnant inmates. Pregnant inmates pose additional concerns, with a study by Johns Hopkins Medicine, 2019, revealing that nearly 1,400 pregnant women were admitted to U.S. state and federal prisons in 2017. There are currently no mandatory standards for prenatal care for female prisoners, highlighting the need for improved maternity care within the prison system. History of abuse and mental health needs. The mental health needs of female offenders are a growing concern. Over 2/3 of incarcerated women report a history of mental health problems, far exceeding their male counterparts. Evidence-based interventions addressing trauma-related distress and mental health concerns are crucial to reducing female reentry into the criminal justice system. Reintegration and support. Successful reintegration into society for female offenders requires suitable housing, sustainable employment, family reunification, and access to post-release treatment and counseling for physical and mental well-being. Female reentry programs must prioritize protecting women from reentering abusive relationships. The devastating effect of an ever-increasing rate of women's incarceration cannot be taken lightly. The rising incarceration rates of women in the United States have far-reaching consequences, especially for children and families. Addressing the unique needs of female offenders, supporting family bonds, and providing essential resources are essential steps toward mitigating the impact of this trend on society. Women persist, breaking through the mold. Empowered by stories that must be told. In the face of challenges, they stand tall. Striving for equality, breaking the wall. We shatter stereotypes, one by one. Our journey for fairness is far from done. Much appreciation to you for giving of your time with us at Motivation at Hand. To know is to know how. We trust you will come back soon.